would have a week where 3 or 4 different patients would be extremely worried that their child had a very rare, genetic condition. And I was like, where is this coming from? And, when I start to search, of course, there's a viral, TikTok video on this subject. Because when you have a kid with a fever at 2 a.m. and they're miserable and you're miserable because you just woke up and you're in your pajamas, you were maybe charting, want your kid to feel better.
We really haven't done a great job of it. And so if we don't take hold of it, right, there's going to be forces from the outside, or else entrepreneurs will leave their walls and do their own thing.
Good morning, everyone. I'm Dr. Kalia, back with Signals and Symptoms podcast with my two besties and co-hosts, Harvey Castro and Edward Marx. Interestingly, all three of us are in Texas, and I'm so grateful to be joined by our own Dallas Texan person, Dr. Isha Mannering. Dr. Isha Mannering is a board-certified pediatrician, and then she is pivoting towards basically making sure that in this age of AI, people understand how to use AI, I believe. And basically, we want to learn from her.
I'm so excited to have this conversation because I think we need to have it. And just as a little background for myself, I have been in clinical practice for over 12 years. One of the reasons I branched out and created Intune MD is just to work on reestablishing those strong connections within our community, for our patients.
Ed, why don't you start today's questions? What are you sort of?
And so what led you to this aha moment that I'm going to start my own company and help other people? Because you obviously see the impact of AI, and so you're taking action.
Well, it was a slow process. It's been more over the past probably 5 or 6 years that I have seen patients start to lose a little bit of that trust and connection with their physicians. There's a lot more of that disjointed care where maybe we're going to urgent care. This is very different than when I first started practicing as a pediatrician. And what that trend kind of led me to feel is that we need to do a little bit more in terms of adapting to the times right now. And we need to kind of regain that trust. We need to kind of be on the same level, and we need to know what our patients are looking at. And I think that's something that I still see as a gap. And maybe it's because we are so busy and we're trying to, do our best and wear so many hats. But at the same time, it was always interesting to me, trends that I would see. I would have a week where 3 or 4 different patients would be extremely worried that their child had a very rare, genetic condition. And I was like, where is this coming from? And, when I start to search, of course, there's a viral, TikTok video on this subject. And so things like that kind of initiated this chain of thinking. And, with medicine, it's an evolving field. It always has been. And it's kind of on us, whether we ask for it or not, to continue to evolve ourselves so we can serve our patients' needs. I think there's, definitely value in being at the forefront of it rather than playing catch up. And especially when I see this need in the community of, patients not being quite satisfied, doctors not quite being satisfied with, as satisfied with their work as they used to be. There's got to be something we can do to bridge that gap. And that's one of the things that really led me on this journey. And I wanted to be able to have a broader reach and do a little bit more than I was already doing for my patients.
Trust in the modern healthcare era, which is changing starting last year to the next 5 years. So AI healthcare influencer, is that the right way to?
I like that term. I have been looking for the right term to describe it because, along this journey, it's so funny because I've worked with different people to help me kind of build this up. And they're like, well, who do you emulate? Who are you trying to be like? And I'm like, I don't think there's that out there, or at least, enough that it's very visible. So yes, kind of a AI healthcare influencer, but more so kind of understanding how our patients want to receive information and providing it on that level. And I think that's our duty, honestly. I think when it comes to AI, the reason there is some fear and resistance is because a lot of providers don't really understand how it will impact their day to day. And so, in order to really view AI as the tool that it can be, we need to understand its strengths and its limitations. We need to also ensure, transparency regarding its use when it comes to how it's, used in our clinics. And then, personally for the pediatrician side, I think the pediatrician still needs to be the one that's processing all the information and putting all the pieces together. But AI can be such a valuable tool in, gathering the relevant information and kind of what I describe as like the scribe and signal. So it can help us provide all of those things that can make hopefully our lives easier along with our patients' lives.
There's a lot of noise out there with micro influencers like us. And we want to make you a mega influencer. But the more important thing is that how do you go from making X amount in your clinician work to X amount in this work? Because that's the progress that we need to make sure that you get. Right? How have you planned this trajectory, and more importantly, how we can help?
This is the first time in my life, I'm going to be completely honest, that I have had to figure it out as I go along. When we decide to go to medical school and, we choose this career path, everything is goal driven. We have, a set goal in mind. We know what we need to do. We're talking to the people who are going to help us get there. But when you're doing something new and you are just a personal aside, I've had a lot of personal challenges, personal changes. There are a lot of things in my previous practice that weren't quite aligning with how I wanted to practice. So there are a lot of shifts that almost pushed me towards taking that step, which would have been a very hard step to take. And I think sometimes the universe does this where, the universe is trying to send you a signal and you're like, okay, I'm kind of picking up on it, but I'm still kind of scared to step away from my comfort zone. But then that signal gets louder and louder and louder and you can't ignore it anymore. And I felt like that is what gave me actually the push, and the courage to step out. And, along with the next stages, I'm still sort of figuring it out as I go along, but it's been very interesting because I have flown with it. Like I've gone with the flow rather than having a destination in mind and, being straight on that path. And I think there's value in that because you discover where the need is and you go to where the need is.
So this podcast, Dr. Manning, which is bringing in, is amazing. Ed, thoughts on your journey and advice for all of us.
Authenticity is super key. A lot of people are fake, and you kind of see through it, and no one wants to. I mean, you could fool some people, but I think when you're authentic and just real, show yourself as fallible. I think people can connect with you better, trust you more, and you get these better, faster connects.
Just wanted to say, I love Ed's comments about the authenticity because I think that is something that patients feel lacking in the current influencer market right now. And I think it's so important. And if people feel a connection to you, they trust you. And trust is built on authenticity too. And, as a pediatrician, I had to gain the trust of the parents in the room, the adults in the room, but also the kids. And so, I feel like it is a unique field in that it involves, a whole other group of people. So I think that trust aspect has always been so important to me. And I love that part about just, we're always a work in progress, right?
You left your practice, and we all did. We're all independent now, is because when you belong to a larger organization, there's all sorts of hierarchies and culture, and you have to toe the line. You cannot be yourself. I get in trouble all the time. That's why I finally left. I was always getting my hand slapped. And so it was hard to develop relationships and be authentic with people outside of the workplace because I had to be a certain way. So now it's so much more freeing. And then plus with your credentials and, as a pediatrician and your experience, now you'll really be able to gain that trust, gain that following so that you can help more people. So yeah, you're on the right path.
Talk to me about an outpatient setting. How would things change, both in terms of actually seeing the patient, talking to the physician, to the parents, grandparents too, by the way. And then last,
I think from an outpatient standpoint, I kind of envision less computer time for the physician as a whole. And I know that sounds counterintuitive, but when we have the use of, a more advanced scribe technology, that allows for us to make more eye contact with the patient, interact with them, connect with them. That was something very important to me in the outpatient setting, especially with kids. I did not like the idea of me walking in with my laptop, staring at the laptop, clicking on the laptop, not really talking to the kids and their parents, so I would very much just put that laptop down, talk to the patients. And I think when at the end of the day, though, when you have to document everything, it adds so much to your day that it leads to burnout. And we also have this shortage of primary care physicians, and you can almost kind of see why it's building up to that. But I'm hoping that AI technology can help us, sort of claim back our time with our patients and connection with I think what I kind of see it as is, allowing that human connection to grow by taking away some of the scut work, as we call it, and, just really becoming more tuned in to your patients rather than focusing on documentation and going through all the information. So we have half of our brain is there, half of our brain is here. Really want this, this has to be a tool for us to actually connect more with our patients.
Harvey, I know you're not doing urgent care right now, but if you were to, use your mind to prospect, how urgent care pediatric patients will change in the age of AI?
Favorite initial things that I've been sharing is two things. In the discharge summary, and I know you'll appreciate instructions, and depending on your age, it would output either a cartoon for your discharge instruction, a comic strip, a coloring book, and then that would be the thing I would give to the patients. And then the other part that I was trying to get some volunteer money to be donated is I created a NFC plushie that was a goal for cancer patient children's pediatrics, and that they would have this plushie depending where they were in the hospital. And in the process, that plushie would speak their language, how they speak, their favorite voice, if they're 5 or 7, how to speak. And then the NFC would say, hey, they're about to have chemo, because they would have access to their schedule. Oh, they're about to go and get an MRI. So anyway, these were quick ideas that I came up with using AI to leverage it for our patients.
By the way, that is where IZAMD comes from. If people didn't know that, that's my daughter's name. She is 78 days in neonatal ICU. And the saving grace, when I was a fellow of neurocritical care, so I could not walk after a 12-hour shift, let alone take care of a baby. They had a camera set up for me, and I can just check in on her at any time. Just that camera. And we used to live 3 minutes. We could walk to the children's hospital, by the way. And my wife was pumping. It was insane. And that camera was like saving grace for us. Is driving. Is also that we need to put patients into houses so it's much more comfortable. And we can do that now. I mean, if Uber can somehow, logistically speaking, can put 2 drivers to this, we can bring in radiology lab, everything into the home. We can do that now. There's no question about it. It's just a question of just getting through the regulation, believe it or not. And then lastly, and now taking to your practice in Dallas, Texas, and my experience as in Dallas, Texas, by the way, UT Southwestern here. This is not something like, oh wait, this is literally UT Southwestern in downtown. How do you envision? And then lastly, close it. How would you teach people?
And to kind of take from the title of your podcast, the signal part, I think, is a big aspect of what AI can do for us. And so one of the things that I see in the pediatric realm is to help us identify earlier certain risk factors or warning signs, because kids can decompensate so quickly, and especially, infants, neonates. I mean, there's a reason we say never trust a newborn, because they can look perfect, to you, but there might be something. That's where you have to develop the spidey sense a little bit. Like, there's a little bit of that, like something's just not right. And, you can rely on that, but what if there are other tools that AI can help with that can help us identify those early indicators that are more validated and, replicable that everybody could use? And what if that helps to signal patterns that deserve more immediate attention and prevent the bounce back to the ER and things like that too? So I think there's definitely a lot of value there that is in the works, but we are going to see that flesh out even more over time.
My point is this: in medicine, we all know medicine. Now leverage these tools, and to me, it's human plus AI together, and what can we do to improve our patient care? So as you start learning these tools, as you start realizing what you can and cannot do, leverage it for our patients. So I think this goes right in place with what we're talking about.
And one other application I just wanted to mention, and this is already happening in pediatrics, is at-home sick care, right? Because when you have a kid with a fever at 2 a.m. and they're miserable and you're miserable because you just woke up and you're in your pajamas, you were maybe charting, but whatever, you're at home, you don't want to necessarily leave your house to go to the urgent care ER. You just want to fix their problem. You want your kid to feel better. You need to get back to what you need to do. You need to take care of your patients the next day, or whatever it is that you do. So, the value of having tools where, you can have like these really high level otoscopes and stethoscopes that can be used by patients at home in their pajamas at 2 a.m. that can give good quality clinical information to a clinician who can help interpret that and help take care of their child's needs quickly, safely, efficiently. I mean, I think there's so much value to that too.
But let's just say we actually build $1 billion company, and then how am I going to be having significant trouble when I'm going to siphon patients in a walled garden to a home garden? And then how are you going to convince hospital systems that this is a good thing?
Well, I think that hospital systems have had generations to take care of their patients in the way that they want to be taken care of with the technology available. And we really haven't done a great job of it. And so if we don't take hold of it, right, there's going to be forces from the outside. And we're seeing that already. I think we've talked about that in previous episodes, that are coming in and providing these type of services and may not have the same pure intent as people who have dedicated their lives to serving other people in healthcare. So I think it's a wake-up call right now that we got to get with it. We have to be more progressive. So I think, to answer your question, right, it's like hospitals have to get a hold of this and start allowing entrepreneurship within their walls, or else entrepreneurs will leave their walls and do their own thing, and ultimately they will become disintermediated.
Have fun with this technology. It's like riding a bike. The more you use it, the better you get at it. And then to be creative with it, leverage what you know. So if you're a physician, you're a nurse, leverage it. And then for me, my passion is patients. So whatever you're passionate about, combine it with AI, human plus AI, and do something for our humanity.
And then do not get worried, as Harvey just suggested. Keep working on it, have fun with it, and then make sure that you teach it to your kids in a safe fashion. Thank you very much. See you next week.